Hello everyone! Welcome back to MJ Pharma. Today's video is a rapid-fire review of miscellaneous drug of choice, conditions from anaphylactic shock to erectile dysfunction, motion sickness to meningitis, and more. Ready to test your speed and recall? Let's begin! Drug of choice for delayed hypersensitivity. Promethazine. Drug of choice for reversal of neuromuscular blockade. Neostigmine. Drug of choice for edema by liver cirrhosis. Spironolactone. Drug of choice for resistant edema. Spironolactone. Drug of choice for septic shock. Norepinephrine. Drug of choice for anaphylactic shock. Adrenaline. Drug of choice for steroid-induced osteoporosis. Alendronate. Drug of choice for erectile dysfunction. Sildenafil. Drug of choice for clonidine-induced rebound hypertension. Phentolamine, tolazoline. Drug of choice for congenital megacolon. Befanacal. Drug of choice for postoperative urinary retention. Befanacal. Drug of choice for paralytic ileus. Befanacal. Drug of choice for dystonia. Benzhexol. Drug of choice for akathisia. Propranolol. Drug of choice for the malignant neuroleptic syndrome, MNS. Dantrolene. Drug of choice for Wegener's granulomatosis. Cyclophosphamide. Drug of choice for hepatic encephalopathy. Lactulose. Drug of choice for cisplatin-induced vomiting. Ondansetron. Drug of choice for cardiac arrest. Adrenaline. Drug of choice for Sjogren's syndrome. Cevimeline. Drug of choice for postural hypotension. Midodrine. Drug of choice for levodopa-induced vomiting. Domperidone. Drug of choice for methotrexate toxicity. Folinic acid. Drug of choice for temporal arteritis. Steroids. Drug of choice for hepatic encephalopathy. Lactulose. Drug of choice for chronic suppurative otitis media, CSOM. Ciprofloxacin. Drug of choice for otosclerosis. Sodium fluoride. Drug of choice for tonsillitis. Penicillin. Drug of choice for pheochromocytoma. Phenoxybenzamine. Drug of choice for erectile dysfunction. Sildenafil citrate. Drug of choice for priapism. Adrenaline. Drug of choice for aortic dissection. Asmolol. Drug of choice for perioperative cardiac arrhythmias. Asmolol. Treatment of choice for dengue hemorrhagic fever. Platelets. Treatment of choice for dengue shock syndrome. Colloids. Drug of choice for Wilson disease. Zinc acetate. Drug of choice for neonatal meningitis. Cefotaxime. Drug of choice for Lambert-Eaton syndrome. 3. For aminopyridine plus pyridostigmine. Drug of choice for arthritis mutilans. Etanercept. Drug of choice for Guillain-Barre syndrome. I.V immunoglobulins. Drug of choice for transverse myelitis. I.V methylprednisolone. Drug of choice for chronic inflammatory demyelinating polyneuropathy. I.V methylprednisolone. Drug of choice for Paget's disease of bone. Bisphosphonate. Drug of choice for postmenopausal osteoporosis. Alendronate. Drug of choice for edema by liver cirrhosis. Spironolactone. Drug of choice for a vasodilatory shock. Norepinephrine. Drug of choice for otitis media. Amoxicillin. Drug of choice for endometriosis. Danazol. Drug of choice for reducing vertical transmission from HIV mother to fetus. Nevirapine. Drug of choice for diarrhea and carcinoid tumor. Octreotide. Drug of choice for diarrhea in HIV patient. Octreotide. Drug of choice for hepatitis B. Entecavir. Drug of choice for suppression of premature labor. Isoxaprine. Drug of choice for short-term increase in blood pressure. Mephenteramine. Drug of choice for mountain sickness. Acetazolamide. Drug of choice for narcolepsy. Modafinil. Drug of choice for hypotension during spinal anesthesia. Ephedrine. Drug of choice for myasthenia gravis. Neostigmine. Drug of choice for low-tension glaucoma. Latanoprost. Drug of choice for bruxism. Botulinum toxin A. Drug of choice for blepharospasm. Botulinum toxin A. Drug of choice for priapism. Adrenaline. Drug of choice for pupillary dilation without cycloplegia. Phenylephrine. Drug of choice for motion sickness. Scopolamine. Drug of choice for morning sickness. Prochlorperazine. Drug of choice for vertigo. Cinnarizine. Drug of choice for ureteric colic. Diclofenac. Drug of choice for spasmodic pain. Drotaverine. Drug of choice for cholinergic crisis. Atropine. Drug of choice for hyperhidrosis. Atropine. Drug of choice for iridocyclitis. Atropine. Drug of choice for corneal ulcer. Atropine. Drug of choice for vagal-mediated bradycardia. Atropine. Drug of choice for sick sinus syndrome. Atropine. Drug of choice for preventing reflux laryngospasm. Atropine. Drug of choice for congestive heart failure, CHF. Dobutamine. This is for educational awareness only. Always refer to clinical guidelines or a medical practitioner before making any therapeutic decisions. Thanks for watching. If this helped, like, subscribe, and hit that bell icon to stay updated with MJ Pharma.